If you are on Medicare or if someone you love is enrolled in Medicare, there is a change to your monthly costs in 2026 that you need to know about right now because it is already affecting the amount being deducted from Social Security checks, and it is larger than anything we have seen in several years. The standard Medicare Part B premium, which is the monthly amount that most Medicare beneficiaries pay for their outpatient medical coverage, has jumped to $202.90 per month in 2026. That is an increase of nearly $18 per month compared to the previous year, which works out to a 9.7% increase in a single year. For people who are on fixed incomes and who depend on Social Security as their primary or only source of income, an $18 monthly increase in their Medicare premium is not a small or abstract number. It is $18 less for groceries, for medications, for utility bills, or for any of the other essential expenses that make up the daily financial reality of retirement. And when you add the annual deductible, which has also increased to $283 for 2026, the total out-of-pocket exposure from Part B alone has grown in ways that deserve serious attention and serious planning. We are covering all of it today. Hello, everyone, and welcome back to U.S. Benefits Update. I am your host, Claire Hollister, and thank you so much for joining us today. This channel is dedicated to making sure that every Medicare beneficiary, every Social Security recipient, and every family member who helps an older adult navigate the healthcare system has access to the clearest and most complete information about the changes that affect their coverage and their costs. Medicare is one of the most important programs in the United States government, covering more than 65 million Americans, and changes to its costs and structure have real financial consequences for tens of millions of households. Today, we are walking through the 2026 Medicare Part B premium increase in complete detail so that you understand exactly what has changed, why it changed, who is affected and how, and what you can do to manage the impact on your budget. Let us get right into it. Here is the full picture of what has changed for Medicare Part B in 2026. The Centers for Medicare and Medicaid Services, which is the federal agency that administers Medicare, announced that the standard monthly premium for Medicare Part B has been set at $202.90 for 2026. This represents an increase of $17.90 from the previous year's premium of $185 per month, a jump of 9.7%. This is the largest percentage increase in Medicare Part B premiums in several years and significantly exceeds the 2.5% cost of living adjustment that Social Security recipients received for 2026. The annual deductible for Medicare Part B has also increased, rising to $283 for 2026, up from $240 the previous year, an increase of $43 or nearly 18%. The deductible is the amount that a Medicare beneficiary must pay out of pocket for covered Part B services before Medicare begins paying its share of the costs. For someone who receives any covered Part B service early in the year before the deductible is met, this increased deductible represents a direct additional cost that was not present at the same level in the prior year. The combination of the higher premium and the higher deductible means that a Medicare Part B beneficiary in 2026 will pay $202.90 every month for their coverage, plus up to $283 in deductible costs before their coverage kicks in fully. Over the course of a full year, the total minimum exposure from Part B premiums alone is $2,434.80, and when the deductible is added for someone who uses Part B services, the annual out-of-pocket baseline can reach $2,717.80 before any additional cost sharing for individual services is considered. These are significant numbers for people on fixed incomes. To understand why this increase is happening and why it is as large as it is, we need to look at the specific factors that drive Medicare Part B premium calculations and why 2026 represents a particularly significant year in that calculation. The Medicare Part B premium setting process is governed by statute and involves a formula that considers the projected costs of providing Part B benefits in the upcoming year, adjustments for unexpected costs or savings in the prior year, and certain hold harmless protections that limit premium increases for some beneficiaries. Understanding this formula helps explain both why the premium increased so sharply and what factors are driving the increase. Medicare Part B covers outpatient medical services, including physician visits, preventive services, outpatient hospital care, laboratory tests, mental health services, durable medical equipment, and in many cases, home health services. The cost of providing these services has been rising, reflecting the broader trend of healthcare cost inflation that affects the entire American healthcare system. But beyond general healthcare inflation, there are specific factors driving the 2026 Part B premium increase that deserve direct explanation. A significant contributor to the 2026 premium increase is the rising cost of prescription drugs that are administered in physician offices and outpatient settings, and that are therefore covered under Part B rather than Part D. Several high-cost specialty medications and biologic drugs that are administered in clinical settings have seen price increases, and the utilization of these drugs among the Medicare population has grown as they become more widely prescribed for conditions including cancer, rheumatoid arthritis, macular degeneration, and other serious conditions that disproportionately affect older Americans. The cost of these Part B covered drugs is a significant component of overall Part B expenditures, and increases in their prices flow directly into the premium calculation. Additionally, there was an adjustment in the 2026 premium that relates to the actuarial experience of the Medicare program in prior years. When Medicare's actual costs differ from the projections used to set premiums in a prior year, those differences are partially accounted for in subsequent year premium calculations. In years where actual costs exceeded projections, the following year's premium may need to be set higher than it would otherwise have been to account for the funding shortfall. This actuarial adjustment mechanism is one of the reasons that Medicare Part B premiums do not always move in a straight line and can sometimes increase sharply in a single year following a period of relatively stable premiums. Let us now be specific about who pays the standard Medicare Part B premium of $202.90 and who may be subject to different amounts. The Medicare Part B premium structure is not a single flat amount for everyone, and understanding the different tiers helps beneficiaries understand their own specific situation. The standard premium of $202.90 applies to the majority of Medicare Part B beneficiaries, specifically those whose modified adjusted gross income from 2 years prior, meaning their 2024 income for the 2026 premium calculation was below $85,000 for single filers or below $170,000 for married couples filing jointly. This means that most Medicare beneficiaries pay the standard amount, and most of the discussion in this video about the impact of the premium increase applies directly to them. However, beneficiaries with higher incomes are subject to what is called the Income-Related Monthly Adjustment Amount, or IRMAA, which adds a surcharge on top of the standard premium based on income level. The IRMAA surcharges apply in tiers, with the premium increasing at each income tier above the standard threshold. At the highest income tier, the total Part B premium can reach over $500 per month for an individual. The IRMAA calculation uses income from 2 years prior, which means that a beneficiary who had a high-income year due to a one-time event like selling a home or receiving a large retirement distribution might face higher premiums in a subsequent year based on that atypically high income. IRMAA can be appealed if the prior year income that triggered it no longer reflects the beneficiary's current financial situation, and this is an important option that affected beneficiaries should be aware of. Beneficiaries who qualify for the Medicare Savings Programs, which are state-administered programs for low-income Medicare beneficiaries, may have their Part B premiums paid entirely or partially by their state Medicaid program. The Medicare Savings Programs include the Qualified Medicare Beneficiary Program, the Specified Low-Income Medicare Beneficiary Program, the Qualifying Individual Program, and the Qualified Disabled and Working Individuals Program, each of which covers different aspects of Medicare cost sharing for beneficiaries at different income and asset levels. Beneficiaries who are struggling with the cost of their Medicare premiums should explore whether they qualify for one of these programs, as the income and asset thresholds are set at levels that many low-income retirees meet. One of the most important protections that exists in the Medicare premium system is the Hold Harmless provision. And understanding how it works and who it protects is essential for interpreting the real-world impact of the 2026 premium increase on different groups of beneficiaries. The Hold Harmless provision is a federal law that protects most Social Security recipients from having their net Social Security benefit reduced from 1 year to the next solely because of an increase in the Medicare Part B premium. In practical terms, this means that if the increase in the Medicare Part B premium for a given year would be larger than the dollar amount of the Social Security COLA increase for that year, the Part B premium for a protected beneficiary is capped at the amount of their COLA increase so that their net Social Security check does not go down. For 2026, the Social Security COLA was 2.5%, which for many beneficiaries translates to an increase in their monthly Social Security check that is smaller than the $18 increase in the Medicare Part B premium. However, the Hold Harmless protection ensures that the Part B premium cannot increase by more than the dollar amount of the COLA increase for those protected beneficiaries, meaning that some beneficiaries may actually be paying a slightly lower Part B premium than the standard $202.90 if their COLA increase in dollars is less than $18. Importantly, not all Medicare beneficiaries are protected by the Hold Harmless provision. The protection does not apply to new Medicare enrollees who were not enrolled in both Medicare and Social Security in the prior year, to beneficiaries who do not have their premiums deducted from their Social Security benefits, to beneficiaries who pay IRMAA surcharges, and to Medicaid beneficiaries whose premiums are paid by the state. These groups are subject to the full standard premium of $202.90, regardless of the Hold Harmless rule. The 2026 Medicare Part B premium took effect on January 1, 2026, and is currently being deducted from the Social Security checks of enrolled beneficiaries. For beneficiaries who receive Social Security benefits and who are enrolled in Part B, the premium deduction is automatic and began with the January 2026 payment. Beneficiaries who pay their Part B premium directly, rather than having it deducted from Social Security, received notices from Medicare indicating the new premium amount and the payment schedule for 2026. The annual deductible of $283 resets on January 1st of each year, meaning that beneficiaries who receive any covered Part B service in 2026 will need to meet this new higher deductible before Medicare begins paying its share of the costs. For beneficiaries who had already been tracking their deductible spending under the prior year's $240 threshold, the reset at the beginning of 2026 means starting fresh with the new higher amount. Looking ahead, Medicare Part B premiums are adjusted annually, and the 2027 premium will be announced by CMS in the fall of 2026. While it is impossible to predict exactly what the 2027 premium will be, the factors driving the 2026 increase, including drug costs and utilization trends, are expected to continue, suggesting that further increases are possible in subsequent years. Medicare beneficiaries should plan their healthcare budgets with the expectation that Part B premiums will continue to trend upward over time. And financial advisors who work with retirees consistently recommend building a cushion for rising Medicare costs into retirement income planning. Healthcare economists, Medicare policy analysts, senior advocacy organizations, and financial planners who work with retirees have all weighed in on the 2026 Medicare Part B premium increase. And their perspectives provide important context for understanding both the causes of the increase and the options available to beneficiaries who are feeling its impact. Healthcare economists who study Medicare financing have pointed to the structural tension in the Medicare Part B program between the goal of providing comprehensive coverage of outpatient medical services and the reality that the cost of providing those services continues to rise faster than the incomes of most Medicare beneficiaries. They note that the 9.7% premium increase significantly outpaces both general inflation and the Social Security COLA, meaning that Medicare beneficiaries are experiencing a real reduction in their purchasing power even in years when they receive a Social Security cost of living adjustment. These economists have called for structural reforms to the Medicare premium setting process that would more equitably distribute the cost burden and provide more protection to lower-income beneficiaries. AARP and other senior advocacy organizations have been vocal in expressing concern about the size of the 2026 premium increase and its disproportionate impact on lower-income Medicare beneficiaries who are most dependent on Social Security as their sole or primary source of income. These organizations have called for expanded access to the Medicare savings programs, arguing that the income and asset thresholds for these programs are too low and that many beneficiaries who are genuinely struggling to afford their Medicare costs do not currently qualify for assistance. They have also advocated for policies that would limit the rate at which Medicare Part B premiums can increase relative to Social Security COLAs. Financial planners who work with retirees have been emphasizing the importance of planning for rising Medicare costs as a central element of retirement income planning, and the 2026 premium increase has prompted many of them to revisit their clients' projected healthcare cost budgets and ensure that they are adequately funded. These advisors note that retirees who plan their retirement budgets around historical Medicare premium levels may find those budgets increasingly strained as premiums continue to rise. And they're advising clients to explore all available cost management options, including Medicare Advantage plans, Medicare savings programs, and other resources. Let us bring this discussion down to the level of real retirees and real budgets, because the numbers we have been discussing have very concrete effects on the daily financial lives of millions of Americans. Think about a 72-year-old widow living alone in the Midwest whose only income is a Social Security benefit of $1,700 per month. After the 2.5% COLA increase for 2026, her gross Social Security benefit rose by approximately $42.50 per month, from about $1,700 to approximately $1,742.50. But her Medicare Part B premium also increased by up to $18 per month. Her net gain from the COLA after accounting for the Part B premium increase is approximately $24.50 per month, assuming the full $18 premium increase applies to her. That $24.50 per month is her entire realized gain from the Social Security COLA for the year, and it must cover her share of increased costs for everything from groceries to prescription medications to home maintenance. The math is tight and the margin is thin. Or consider a couple where both spouses are on Medicare and both receive Social Security benefits. If both spouses are paying the standard Part B premium, their combined monthly Medicare Part B cost in 2026 is $405.80, up from $370 the previous year. That is a combined monthly increase of $35.80, or $429.60 per year. For a couple trying to manage a retirement budget that also includes supplemental insurance premiums, prescription drug costs, and all of their other living expenses, this kind of year-over-year increase in healthcare costs is a genuinely significant budget challenge. For newly eligible Medicare beneficiaries who are turning 65 in 2026 and enrolling in Medicare for the first time, the $202.90 premium may be the starting point for their Medicare experience. But they should understand that this amount will almost certainly continue to rise over the course of their retirement. A 65-year-old who enrolls in Medicare today and remains enrolled for 25 years will experience many premium increases over that period, and planning for that long-term trajectory is an important element of retirement financial health. Let us close with a complete and clear summary of the most important information from today's video. The standard Medicare Part B monthly premium for 2026 is $202.90, representing an increase of $17.90 or 9.7% compared to 2025. The annual Part B deductible for 2026 is $283, up from $240 in the prior year. The premium is automatically deducted from Social Security benefits for most enrolled beneficiaries. Higher-income beneficiaries pay additional IRMAA surcharges above the standard premium amount. The Hold Harmless provision protects most Social Security recipients from having their net benefit reduced by premium increases, but the protection does not apply to all beneficiaries. Low-income beneficiaries may qualify for Medicare savings programs that can pay their premiums and other cost sharing. And exploring eligibility for these programs is one of the most important steps available to beneficiaries who are struggling with the cost. IRMAA surcharges based on atypically high prior year income can be appealed if current income is significantly lower. Financial planning for rising Medicare costs is an essential element of retirement income planning, and the 2026 increase underscores the importance of building healthcare cost inflation into long-term retirement budgets. Before we wrap up today, we want to hear from you. Has the Medicare Part B premium increase affected your budget in 2026? Have you explored the Medicare savings programs to see if you qualify for premium assistance? Do you have questions about IRMAA, the Hold Harmless provision, or how to appeal a premium surcharge based on prior year income? Drop your questions and your experiences in the comments section below. The Medicare community in our comments section is engaged and knowledgeable, and the shared experience of navigating these cost increases is genuinely helpful for everyone. If this video gave you clear and useful information about the 2026 Medicare Part B premium increase, please give it a thumbs up and share it with every Medicare beneficiary and every family member who helps an older adult manage their healthcare costs. Subscribe to U.S. Benefits Update and turn on your notifications so you never miss a Medicare, Social Security, or government benefits update. I am Claire Hollister, and thank you so much for watching today. We will see you in the very next video.